Your date of birth?
Yeah, 08/16/1997.
Okay, before we get started, I just wanted to let you know that anything we talk about will stay here between us and be totally confidential. The only exception is if you let me know you're getting hurt by someone else or you're hurting someone else.
Correct.
And then in that case, I would need to get you some help. Is it okay if we continue?
Yes.
Okay. So my understanding is that you're here for birth control?
Yes.
Okay. Do you have a certain birth control in mind?
Nexplanon.
Okay. Do you know anybody? What do you know about it?
That it gets you obese. Right?
Who told you that?
One of my friends.
Okay. She has a Nexplanon?
2.
She has it next month?
Mm-hmm.
Okay. It does increase your hunger.
Mm-hmm.
The birth control itself doesn't get you fat.
Mm-hmm.
But it may increase your hunger, and then if you eat a lot, then it might increase your weight.
Okay.
So you just have to be very careful when you get hungry. Try to go for the healthier choices.
Mm-hmm.
Do you know where it goes?
In your arm.
Okay. Yes, it does go in your arm. Do you know if it has hormones?
Yeah, it has some.
Okay.
Okay.
So let me give you a little bit more information. Okay. So when we place it in your arm, the way it works is that it releases hormones into your bloodstream, which prevents you from getting pregnant. When you don't have to really worry about it like you would with the birth control pill.
Mm-hmm.
The birth control pill, you would obviously have to take it every day at the same time. And with this one, you just have it in your arm. You just have to make sure you do use the correct barriers, like condoms, spermicide, things like that. Mainly condoms, women condoms, male condoms, just to protect you from STDs, because the Nexplanon doesn't prevent you from getting STDs. The effectiveness is 100%, so it has a pretty good rate. There's obviously 1 or 2 women that get pregnant, but it's not very likely. Some of the pros are that it has very few side effects, unlike other birth controls. And then once inserted, you don't have to remember to take any pills. It's just there, it's releasing hormones, and it's preventing you from getting pregnant for the next 3 years. It is a method that you would keep in 3 years. It works up to 3 years. You don't necessarily have to keep it in there for 3 years. If you decide that in a year you want to get pregnant, you can come in and get it removed easily. Some of the side effects that it might change your mood. It might make you moody. It may increase changes in your period. You might not get a period. You might get spotting in between. Your appetite might increase. Some of the warning signs would be that you would need to watch out after you have it inserted would be to make sure it's not warm to the touch, that it's not infected. If it's still painful and it's been a month, then you might want to come back in, so then that way we can go ahead and look at it. You would get it, where would you get it? You would obviously get it here. You would get it inserted by a provider. They would make a little small incision and click on a button, and it would just insert itself in. It would take up to, I believe, 2 weeks to fully kick in. You have to make sure you do use condoms for that period. Push pause it. Okay, so here's an example of the implant. This is the way it looks. Once you get it inserted, this is what will be inserted into your arm. And then if you want to go ahead and feel it, you can feel the implant right here. Just move your finger around. Okay,
That's weird.
feels weird. And then I do have a handout on it where it explains a little more. Let me see. Then it explains to how it is placed and how it's removed. So this is where I was telling you, where they use a little machine where they basically make a little incision, push on it, and then automatically go into your arm. To get it removed, the provider would make another small incision, and then grab some forceps and pull it out. They do numb your arm, so you won't feel it. Patients usually say the most painful part is when they're getting the medication inserted to get their arm numb or their area numb. That's where they say that they can feel it. So this is also telling you where you should know when to call a provider if there's any warning signs, anything that you think is not right. See, like pain in the lower leg that doesn't go away. Severe chest pain or heaviness in your chest. Hard time breathing. Make sure you do come in or call a doctor. If it is really bad, then make sure you do go to the emergency room. And then it is an estrogen implant. Which question? Okay, do you understand how it works?
Of course.
Okay, I'm gonna ask you a couple questions, okay? What is the effectiveness of it? Of the implant?
100%.
Okay. Almost 100%.
Almost.
Okay.
1 out of 2. I mean, 2 women possibly can get pregnant.
Okay. Where is it placed?
In your arm.
Okay. Do you have any questions for me?
Yes. Are some of the warning signs just dangerous?
Some of them maybe if you go for a long time, like the chest, the breathing, not being able to breathe good, then you would obviously need to go to the emergency room. That would be a dangerous one.
Okay. Thank you.
Pain in your leg too.
Okay.
It might be pretty dangerous. So make sure you do, as soon as you do see signs that don't go away like that, make sure you do come in, or obviously if you're really having a hard time breathing, make sure you do go to the emergency room. Okay.
Will do.
So do you think? Oh yes.
I think I'm gonna get it.
Okay, I was about to ask you. Do you think this is the right method for you?
Yes, because I'm not good with pills.
Okay. Okay, and then can you just really quick explain to me some of the warning signs you might have to look for? Make sure you're not having that.
Pain in the chest, pain in your leg.
Okay. Yeah. So I think you get a pretty good understanding of what the Nexplanon is, and if you're pretty sure you want the Nexplanon, I'm just gonna go ahead and have you fill out some papers to get it placed, or make you the appointment. I'll make you the appointment for the implant, and then we can probably have you sign the papers today, and just have them for that day, ready for the provider to insert the implant.
Thank you.